Hello and welcome to Leaders of Tomorrow, India's largest platform for entrepreneurs. Any questions that you have related to any aspect of your business, we cover it here on the show. Tonight, I'm bringing you part one of the Leaders of Tomorrow Masterclass, a digital-first platform where we get entrepreneurs like yourself onto a national platform and give you the opportunity to ask your questions live to our panel of experts. Today, we're talking about a vaccine boost to the economy. What really is going to be the kind of growth we can expect to see with this mass rollout of vaccines? Should the government be allowing democratization really of pricing? Should more and more entrepreneurs be given the opportunity to manufacture? What really is going to be the impact for small businesses which have already been reeling in 2020 with the second and possibly the third wave of the pandemic? All of that being covered here on this masterclass. Let me dive right in and introduce our panelists. We have Dr. A Velumani, he's the Chairman and MD of Thyrocare. We also have Dilip Chenoy, Secretary General of FICCI, and Saugata Bhattacharya, Executive Vice President, Chief Economist at Axis Bank. Gentlemen, thank you so much for your time here on the show. My first question to you is about really the mass rollout of the vaccination program and keeping in line with the theme that we really have for this masterclass. The government, of course, now opening up vaccination for the 18 plus group. Even as we're struggling to really find vaccines, even as there's a mass vaccine shortage, most experts saying for the next 2 to 3 months there are going to be no vaccinations available. My question is, should the government perhaps be restricting this to a critical mass of the population? Should they ensure that everyone who's 45 plus, who hasn't got a vaccine, hasn't got the first or the second dose, should first be vaccinated before they look at opening it up to every other age group as well? Will that perhaps bring confidence and growth back into the economy? That's my question. It's open to all three of you.
The second wave, the way in which it has surged, the way in which it has put into a lot of distress, especially Delhi. The fear is when this second wave will end, how long this 4,000 plus deaths will continue is occupying the minds of politicians, bureaucrats, scientists, as well as entrepreneurs.
Okay.
Without the second wave, if we had analyzed, we would have kept vaccination as, you can always tell preferable, better if we have. Today, we realize there is no exit from this virus without a vaccination. And not that one city, one state, one country vaccinated is a solution. Entire humanity of 8 billion population needs vaccination. And this has to be done fastest. Do we have the manufacturing capabilities? Only 2 companies appear to have licenses as well as manufacturing capabilities and started the work. But I must tell you, the task in front of us is such a huge one. Everybody, all stakeholders have to put in their best together, coordinating each other. In fact, this intellectual property of COVID vaccine, should it be allowed? Are we truly cheating if we take it out from the hands of the people who own it? Is this a special situation where we can afford to do that, compensate for this? So there are a lot more questions in having vaccination, vaccinating, how fast we do. A lot of questions are there. It's very difficult for me to right now tell when our economy will be back.
Dr. Velumani, one sentence that you said that's really resonating with me. There's going to be no exit from the virus if there is no vaccine. Unfortunately, a lot of people still continuing to debate the efficacy of being vaccinated. Dilip, my question to you though is the vaccine going to be that one single factor that's going to bring much needed growth back into the economy?
I agree with Dr. Velumani that the vaccine is critical to bring activity back in the country. You know, a lot of people actually do not realize that because of the insistence to vaccinate frontline workers on a priority basis a few months ago, that the number of cases and deaths in the frontline workers in this current pandemic is not that great. They're getting infected because of other reasons, but the level of infection is not that severe, and the recovery period and recovery time is also a bit better.
Sure.
So the first thing is that unless everybody gets vaccinated, the load on the hospital system and the other things, should there be another wave, is dramatically going to increase. And the only solution to that will be either micro lockdowns or statewide lockdowns, and that's going to curb economic activity. Unless we focus on the vaccination effort, it's going to actually contain economic activity if there's a further spread of the pandemic. The second, very, very clearly, is that even if we vaccinate, right, and what is coming out, we still will have to follow COVID appropriate behavior for some time, because still the entire, a certain percentage of the population is vaccinated, and we develop kind of a herd immunity there. We have to continue COVID appropriate behavior. A lot of people, when they got vaccinated, felt that they could possibly not wear a mask, not do social distancing, and were kind of a bit casual, and that led to an expansion. So I think vaccination is important, but till we increase the pace of vaccination and everybody, a certain percentage gets vaccinated, we have to continue COVID appropriate behavior.
So Saugata, my question to you as part of your opening remarks. Last year, if you look at 2020, the estimates are that the economy, there's been a loss to the GDP of nearly 30 lakh crores. My question is, are there any figures available right now to indicate to us that if the vaccination program, the mass vaccination program, 18 plus, were to go through, what kind of loss will we perhaps see? If there's a delay to the stated plan, what kind of losses are we likely to see? Any sort of figures that you can put?
So the impact is already visible, and it's likely to increase. So as we chatted, 20 to 30 lakhs lost, lakhs of rupees lost last year. Probably another 5 to 10 lakh rupees lost this year, and there's a permanent loss. All three of us agree that vaccinations, without vaccinations, there is no way out. I mean, you will not be able to escape this pandemic. But vaccinations, because of the sheer shortage of raw materials, of production capacity, etc., is only going to be a medium-term solution. You're not going to be able to vaccinate, just not going to be able to vaccinate enough people over the next 2 or 3 months. So you have to have a lockdown. There is no other way to do this.
Sure.
Remember that Boris Johnson in the UK attributed the drop in the UK cases to the very severe stringent lockdown that they imposed in January. And after that, the UK started the vaccination. So you have to have a lockdown. And we are seeing that across multiple states, districts, targeted, mass, etc. Our own sense is that our own FY22, the year that we are in, GDP growth is likely to be about 9.5 to 10.5, although this is an evolving target as and when the epidemic evolves. I mean, we keep. So this is down from about 11.8% prior to the pandemic, the second wave of the pandemic. But remember one thing that I must stress, that these are likely to be the official estimates, which will be based on the data for the bigger companies. And the bigger companies are still doing very well. I mean, the bigger companies will not be losing that much of income. The true cost, economic cost, loss of incomes in the economy amongst the mid companies, and particularly the small micro businesses, on the enterprises, etc. in the company, the effect has been very, very much larger.
Our first question coming in already, and this is from our viewer, Catherine Neal. This is coming in to Saugata. Saugata, her question is, what should be the other appropriate response of the government after looking at the impact in the economy besides a total and complete lockdown? Can there be any other appropriate response? To Saugata, but it's open to everyone else on the panel as well.
So let me start with this, that initially we started with the lives versus livelihood narrative in last year when we tried to start controlling, flattening the curve, as we used to call it.
Sure.
Now we've realized that this is no longer that binary. It's not a lives versus livelihood boundary at all. The way that our healthcare system has been stressed, the way that, and remember that, I mean, many of us have gone through through the infections phase. It's a very severe dislocation of activity. I mean, just one case does not tell you how big the dislocation is in the immediate economic surrounding of that individual. There's a huge dislocation, much disproportionately larger than that one infection number would suggest.
Okay.
So, I mean, it's no longer a lives versus livelihood boundary. And many people, particularly now, it's spread across in the smaller cities, in the rural areas. If you see the numbers, the numbers are increasingly spreading out from the metros, the larger cities, into the smaller towns in the rural areas, where there's a severe shortage of medical infrastructure and the ability to deal with this, and deaths will likely increase. So, I mean, I completely agree that, I mean, savings have already been severely depleted, income opportunities and incomes have been impacted and hit. But unfortunately, as of this point in time, because of a lagged public health response, as of this point in time, particularly for the next 15 days, 30 days or whatever, I do not think there is an alternative to a lockdown.
Gentlemen, I have to take a very quick break on that note. We're back in just a moment. Welcome back. You're with us here on Leaders of Tomorrow Masterclass. Tonight, we're talking about the vaccine boost for the economy. Dr. Velumani, I just want to sort of circle back to the question of who should be vaccinated. Should the government continue focusing on more critical groups, because there are still so many people who are yet to be vaccinated, or should we continue with the stated plan of 18 plus, given all the shortages that are happening, etc.? What comments would you like to offer?
See, unfortunately, the beginning we went in for such a severe lockdown which completely disrupted livelihood. Fortunately, the first wave gave a reprieve much earlier. We became so careless in the month of January and February. We went on and did things where we had lakhs of people accumulating in the same location. Not only that, literally Mumbai trains were fully loaded and all marriages, all functions. Then that results into huge second wave surge across the country. So what is the lesson should be learned? Don't open up fully. Don't lock down fully. As much as if your medical infrastructure can handle, that much keep it open and make sure that you plan well. We were to become world's largest vaccine exporter. Today, we are ending up as the world's largest importer. So having said that, coming to your very specific question, a lot of political pressures, a lot of various non-scientific theories which are getting inside. But having said that, it is not that young, old, even children need to be vaccinated. 16 billion vaccinations are needed, not that 2 months, 3 months we have to wait. We probably have to wait for more than a year or two. Having said that, opening up and telling that 18 plus can undergo in vaccination, when you don't have vaccination is cheating.
Okay.
Almost half of the number of vaccination centers have displayed vaccination out of stock. So it's a wrong move. If the move is right, wrong logistics. If logistics is right, no adequate manufacturing.
So then let's talk about demand and let's talk about consumption. Now, if consumption and demand are really going to come back into the economy. One of the fastest way perhaps is by a way of investments really being made at this point. But who's going to make that investment is my question to the three of you. Is it private industry or should government really continue, because the kind of scale and the kind of investments that can be made can only be done by the government? And if you're saying that it's the government's role, where should they be looking at making those investments if we are hoping to see FY22 come back on track, at least somewhat?
Obviously, I mean, as of this point in time, so a couple of points. I think we all understand that in the manufacturing space, just prior to the second wave of the pandemic, most industries were actually working at full capacity, which is very, I mean, it's paradoxical, but I mean, given the lack of demand, but exports were playing a role. I mean, there was other demand in the system. There were certain sectors, particularly in the consumer durable space, in the white goods space, in retail, warehousing, robotics, renewable spaces, etc., where some private investment, specialty chemicals, Dilip would know much, much better than I would.
Okay.
So there was actually some mid-ticket style, 450 crores, 1,000 crores, 1,500 crores, even bigger investment that was happening. But unfortunately, as of this point in time, this is not big enough to move the investment need. And the government has recognized this. I mean, you saw that in the last budget, that the amount of capex spending that was budgeted in FY22 and even in FY21, some part of this has actually been spent, was way beyond anything that has happened in the past.
Just continue from that, what Saugata said. I think, frankly, the experience that we had during the first time, you see, when the first pandemic started, the lockdown was there, and then we went to different stages of lockdown to unlock one, etc. The experience of different sectors to operate in a contactless digital payment space was limited. Over the 6 months or 7 months of the initial period of last year,
sure,
many companies, including small businesses, and you can actually, if you can, even your local kirana store, he started using WhatsApp messaging and Paytm or whatever it is, and also deliver stuff home, etc. And many businesses actually adopted digitization to ensure that business would continue. And I think that experience of the last pandemic will hold those companies in good stead today when they are faced with a similar lockdown situation currently. Last year, in fact, it happened at the same time, the white goods industry, has lost the season.
Okay.
This year, in some parts of the country, they will lose the season, but the impact on them may not be as large as last time. But the challenge here is, if we don't keep the front end open, we have to find ways to keep the retail end going, because if that is not open, then there's no point in allowing manufacturing to happen, because there will be no evacuation of goods there. So it is an important aspect to look at. And the latest RBI announcements actually focus on the small and individual people. So if you see, we are kind of following a trend like last year. The first thing what they did last time was announce food grain for workers. They've extended that earlier in the announcement. They announced kindly. And the second thing they did last year, again, they've done this year, look at the small businesses, the micro businesses, allow them here. And the difference this time, they've announced a 50,000 crore thing for the healthcare sector for enable them to get working capital and liquidity to ramp up. So I think that's the perspective I'd like to add here.
Our next viewer query coming to us from Smriti. She says she's a director there. This question is directed to Dr. Velumani. She says, what lessons should India have learned from other countries which seem in some way or some sense at least defeated COVID or not in as bad a situation as India is at this point? Dr. Velumani?
In fact, we didn't learn lesson, we got misguided. In the wave one, when Western world had lost around 1,500 deaths per million, India was only 100 deaths per million. So we were complacent, we felt everything is almost done. So I don't think here anything to learn from anyone else. In fact, Kerala model was talked as Kerala model. People learned, and then Kerala didn't succeed. Today, Bombay model seems to be a model talked. So it's not that this COVID has allowed any room for anybody's intelligence to learn from anyone else. Having said that, the end of wave one gave a lot of hopes for India to be back, be faster than any of the economies in the world. And it looked like everything is going to be good for us post 2020. But 2021 has come in like a tsunami. We are unfortunately have no confidence to predict and say what is that likely to happen. But overall, what has not changed in these two waves for economy, our prediction of economy is, there are some companies or industries which are going to have positive impact. There are some who are going to have absolutely negative impact. Positive impact is for healthcare, hospitals, pharmaceuticals, diagnostics, healthcare related manufacturing and hygiene products are going to have huge upside for next 5-10 years. What is going to have the biggest challenge? Airlines to be back as airlines, it might take 2 years to 5 years to 10 years, gone. Hotel industry is gone. Hospitality, travel, tourism is gone. So it's very, very challenging for us when the pandemic is still at such a peak of wave to tell something with wisdom. It's only guesswork.
Okay, that's all we could manage to pack into part one of this masterclass where we're talking about the vaccine boost for the economy. We will bring you part two, however. If you have any questions about how you too can participate in these webinars and masterclasses, do head on over to our website. All of our details are there. For tonight, it's a wrap. Thanks for watching. Here's a sneak peek at what is coming up in part two. Have we become truly Atmanirbhar when it comes to the healthcare space? Looking at what's happening around us, shortage of vaccines, shortage of oxygen, etc. Where perhaps have the gaps been?
I think a lot more support is needed for the manufacturers, not only healthcare, which is the core healthcare, allied healthcare, and it would take some more time.
We didn't know how long the pandemic would actually continue and what the impact would be. So therefore, it was a need to look at alternate supply chains.
Hello and welcome to Leaders of Tomorrow, India's largest platform for entrepreneurs. Tonight you're watching the Leaders of Tomorrow Masterclass, a digital-first platform where we invite entrepreneurs like yourself to participate and ask your questions live on a national platform to some of India's biggest voices and experts. All of May, we're continuing to focus on the pandemic and how India is responding, India's economy is responding, India's entrepreneurs are responding, and what you should know. Tonight, we're bringing you part two of an expert panel that we did do this. We have Dr. A Velumani, who's the chairman and MD of Thyrocare. We also have Dilip Chenoy, Secretary General of FICCI, and Saugata Bhattacharya, Executive Vice President, Chief Economist at Axis Bank. Is the vaccine going to be that one single factor that's going to bring much needed growth back into the economy?
There is no exit from this virus without a vaccination. Entire humanity of 8 billion population needs vaccination.
Unless everybody gets vaccinated, the load on the hospital system and the other things, should there be another wave, is dramatically going to increase.
Loss of incomes in the economy, and particularly the small micro businesses, among enterprises, etc. in the company, the effect has been very, very much larger.
Question coming to us from Gautam Chakrabarti. He says he's a director at Ranelson Private Limited. This disaster was inevitable when our finance ministry had allocated 35,000 crores in the budget of this year, of course, for vaccination of 1.4 billion people. We need to nationalize our healthcare immediately to save our workforce. He continues to say we need to invest at least 15% of the GDP and or follow the NHS system of the UK. I'd like to get the comments of this esteemed panel. Gentlemen, open to all three of you. Who would like to take this on, perhaps?
We can't evolve UK system here. UK has got a per capita income probably 20 times better than India. We have hardly any per capita income. Of course, that amount announced for COVID still not seem to be realizing into a COVID rehabilitation. Otherwise, government should have told all vaccines for all age group will be free. Now, today it's a fight between state and center, between private and government. So we don't have today any ability to compare or emulate anything that the Western world is doing. Having said that, we have a lot of intellectual capability to make vaccines, scale up vaccines, and we must take out the intellectual rights from the guys who have made it. It will look like injustice, but there are not less than 24 number of companies which can manufacture the vaccine provided the recipe is given. I think it is time for us first to look at how to vaccinate, and I don't think this country is having such a bad shape that it can't afford 300 rupees to 400 rupees per citizen in this country. So government has to look at it very, very seriously from vaccination point of view.
Okay.
Nanda, so let me just quick some maths behind this. 35,000 crores, as Dr. Velumani mentioned. So two shots, so 100 billion, 1 crore population, say forget about 150 crores, I mean say 100 crores. And so two shots at 150 rupees, the current contracted price is about 30,000 crores. And about another 10,000, 15,000 crores for transport, etc. So that's about 40,000 crores. That's actually budgeted. Yeah. So I mean, we don't. I need to stress that the vaccines now are a public good. We talk about, if the governor talks about the yield curve as a public good, vaccines are now a public good. I agree with Dr. Velumani that within the constraints of our per capita incomes, of our ability to spend, etc., I think there should be uniform pricing and there should be universally acceptable and accessible to everybody. They should not be treated as a commercial item, commercial good now. Vaccines now are a public good. The government should negotiate. The government can negotiate at a mass scale, mass level, at the best possible prices that it can acquire the vaccines. And then with a very transparent set of criteria distributed across to various states, age groups, whatever criteria the groups of experts decide.
Our next question coming to us from Kishore Tilokani, a couple of questions in fact being bunched in there. He says he's the Chief Digital Officer at Beyond Square Solutions Private Limited. He says by lowering the pressure on the primary healthcare system to address the current emergency and overload, what is the government looking at doing, especially in association with private cooperation? So PPP is what he's talking about when it comes to the vaccine rollout. What additional support required to address the challenges? He has another question. He says large corporates need to play a strategic, active role, not merely contribution of funds to manage the effective rollout of the vaccine, right from sourcing, logistics, distribution, tracking, completion, etc. What are the thoughts of today's panel?
Actually, public-private coordination is not happening. The government thinks private means they will only loot, they will only take away. But if you set the rules and private will follow,
okay,
maybe some percentage will still go beyond the protocols. But I have a reason to believe without private participation, the vaccination is not going to be that simple, that fast. Having said that, every employer wants to vaccinate their employees fastest. But then unfortunately, the vaccination, to whom to give, how much to give, allowed to pay or not is not that simple to decide. Company lacks chief ministers, lack coordination. Ruling parties, opposition parties, all of them have different views. Scientific view is not getting attention. Bureaucratic dominations are deciding. So don't think that I'm talking negative, but I'm telling we need absolute coordination between everyone. We need a vaccine minister for every state and to the center. And these vaccine ministers will have uniform policy. It's not that some state has more need for young people, some other state has a need for less. It should be a policy which is acceptable, uniform across the country, implemented without bias and with highest efficiency.
I'll take that public-private partnership part of it, if I may, on the vaccination. So today, the way the system works is any government entity or any private entity can apply for registration as a vaccinator on the platform. And they have to demonstrate the ability to vaccinate and the ability of the cold chain from taking it from a central point and, delivering it and ensure and convince the people that, there's not going to be wastage of the vaccine. Because if you looked at the numbers that the vaccination, there was some wastage of vaccination across country. So I think there is a possibility there, and there is a possibility to cooperate in enhancing healthcare. And in the Telemedicine Act was actually passed. A lot of telemedicine support could be given to the rural and other hospitals by different private agencies. And there could be a lot of areas of public-private partnership. I think some states are doing it better. Some states are still exploring what could be done. Perhaps, if they learn from each other, it will really help the whole ecosystem.
Our next question coming to us from Sunil Rajak. He says he's founder at Do My Repair. Are we staring at jobless growth in the coming quarters if you're looking at a second wave, extending, a third wave, etc.? Open to everyone on this panel, but Saugata, if you want to take this first.
So remember that these trends, the trends of jobless growth, not just in India, across the world, globally, jobless growth has been a major concern, and political changes have happened around this concern of jobless growth. The US was one spectacular example. So the pandemic just accelerated these trends. As both Dilip and Dr. Velumani mentioned, one of the key changes that have happened is this increasing digitalization, consolidation, formalization, etc. So some companies have benefited and some companies are doing extremely well. But there are a few concerns in this. So over a period of time.
Okay.
So the immediate concern is the loss of jobs particularly in the informal sector and even among small businesses, etc. So that needs to be addressed. So as Dilip mentioned, by significantly targeted lockdowns, the ability to open up within a ring fence, etc. So these are concerns that will drive policy, that should drive policy within the next quarter, half a year, or whatever.
Gentlemen, I have to take a very quick break on that note. We're back in just a moment. Welcome back. You're with us here on Leaders of Tomorrow Masterclass. Tonight, we're talking about the vaccine boost for the economy. Very quickly at this point, I also have, a question of my own, and I want to talk about Atmanirbhar and I want to talk about PLI. Now, the government, of course, announcing last year this whole movement, if I can call it that, of becoming self-sufficient in every sector, in every industry. Have we become truly Atmanirbhar when it comes to the healthcare space? Looking at what's happening around us, shortage of the vaccine, shortage of oxygen, etc. Where perhaps have the gaps been, or is it too soon for us, to have both started and completed perhaps that whole chain of self-sufficiency? That's on one hand. Second, this question is again open to all three of you, is the production-linked incentives, particularly when it comes to manufacture of medical equipment and devices. Now, SMEs, before the budget of this year, of course, saying we want the government to relax the criteria for PLI because we can't really participate in the scheme. It's too capital intensive. Given all of this, are you hopeful that we could perhaps see something by way of commentary from the government, because we didn't hear it in the budget of this year? Hopefully we'll hear something before budget of next year. All of this really sort of contributing to what is happening around us perhaps at this point. Open to all three of you, how would you like to address it?
Healthcare was not focused at all by the government, and it was not the priority. And there are a lot of items which have been having huge custom duty, including tuberculosis.
Okay. And
government has also said a lot that they will support the local manufacturing, the Atmanirbhar, but all were for normal times, all were to work when you don't have a pressure. Now suddenly we are having a pressure, was first wave, now the second wave. I don't think we have enough resources to take care of our needs in healthcare, especially infection related, especially when your hospitalization is demanded. Having said that, a lot of learning, a lot of people have jumped in. Of course, if you get, I think recently Reserve Bank of India has announced just 2 days back, I think 50,000 crore or so to be given to MSMEs. That's a very good move by Reserve Bank of India. At a 4% is a very good rate. Only thing, they should give a 5 years period for its repayment. But I think a lot more support is needed for the manufacturers, not only healthcare, which is the core healthcare, allied healthcare, and it would take some more time. It's not that currently you want a solution and immediately it can be made. So government needs to invest, private needs to invest, investors have to visualize and see that as an opportunity. Then only we will have enough of our own resources. Mind you, 1.35 billion population. It's not that easy to manufacture anything adequately.
Okay.
So I think, Sunanda, just to add to what Mr. Velumani said, and I'll just extend it to the PLI scheme and rationale behind it. So when actually the first wave and the first disruption because of COVID didn't actually happen in March or April of last year, as we think. We typically try to associate 26th March as the date for that, but it actually happened earlier in January. To many sectors of the economy who were dependent on products from China, because China went into a lockdown, and a lot of stuff which was even required for the chemical industry, the APIs for the pharmaceutical industry, for the solar sector, for the paint sector, for the power sector, the close to 39, 40 sectors were actually impacted. At that point of time, we didn't know how long the pandemic would actually continue and what the impact would be. So therefore, it was a need to look at alternate supply chains, and therefore, looking at alternate supply chains was a challenge, and you looked at it. Then when the pandemic struck, you were faced with, non-availability of face masks, of PPE equipment, of ventilators, and a whole lot of other things. And nobody was exporting because everybody was stockpiling and keep it for themselves, and you had to actually produce that in the country. And we actually managed to do something, and we even started exporting a few. We were exporting ventilators earlier, but we started exporting more ventilators there. So the concept behind the Atmanirbhar program and the PLI program is a very, very sound principle. And if the pandemic were to strike in another area where we were dependent for inputs or something, that will actually cripple that, even if there was no pandemic here. So you look at resilient supply chains, alternate supply chains in different sectors. So all the businessmen who are actually listening into this, you need to have at least visibility of alternate supply chains for your own business, even within the country, for example. So I think that is the thing behind it. And I think that you need scale in some to get a kind of a economical production in some sectors. It requires scale, and there's no point in investing and helping investment in subscale things which are not economically viable for the country as a whole. And possibly the way to address that is to get consortiums going, but that's another discussion.
There's another question which is coming to us from our viewer, Atul. He says he's CEO and founder at Quingy Technologies. At this point, is it valid to apply GST on oxygen oscillators and vaccines? Is his question.
Anything on healthcare, especially on oxygen, shouldn't put GST. Anything in healthcare at this moment, you shouldn't add any custom duty. So it is very, very important that for a period till all panic is over, all hospital beds are out of the crisis, no additional tax will help either the economy nor the image of the government. I don't think that should be done.
Okay, I want to take closing comments and, first ask, if you could talk to an entrepreneur who's logged in today to say that FY22, perhaps hopeful that growth will really come back. Where is that growth going to come back? What areas should they be looking at investing in ramping up or at least protecting at this point? What should that strategy look like for them, for an entrepreneur for the rest of FY20?
So I think first, as an entrepreneur, right, you need to move your focus away from global growth projections, domestic growth projections. Don't get entangled in that. Have a razor-sharp focus on the products or services that you manufacture or deliver. Look at what are the new opportunities that you can explore either domestically or globally. If you see that the opportunities are not enough in terms of your capability to manufacture or deliver a service, look at pivoting your businesses and your services to areas where you can see the growth, right? And try and remain on top of the curve that you can actually take that will enable your businesses to either, it's at first you got to survive, revive, and you can thrive. So, this is, if you just follow this and you have a razor sharp vision of where your company wants to go, but look after your people. Your employees are the biggest strength at this point of time. Look after them, motivate them, get them to put their shoulder to the wheel, and collaboration in this case, in these times, is actually much better sometimes than competing. So, this is what I'd like to say at this point of time.
Dilip, thank you very much for your closing comments. Saugata, to you next. And I want to talk about India as an investment destination. Do you think that India, perhaps, for the rest of the year at least, will continue or will see favorable investment and will continue to be viewed as a safe bet, at least, as far as investments are concerned by the global community? In 2020, we did see record inflows coming into the country. Do you expect that will perhaps continue for FY22?
This pandemic is a once-in-a-century crisis, deeply as it has affected us, and we need to work our way through the immediate solutions. This has impacted us very, very deeply. Let's not mince words about that. I think the public health response should have come in earlier. It's now beginning to come in, and hopefully it will extend it for another month, quarter, etc. But beyond that, I think the opportunities are immense.
Sure.
So for anybody who's willing to take risks, the entrepreneurs who are listening to us, they are the experts. And India has developed a fantastic India stack, the digital infrastructure that it's created. And together with that, the finance, the venture capital, the public, the private equity funds that have now, that ecosystem that has now developed. I mean, it's much easier to get funding for something. And anybody who's actually providing a solution to a real problem. It's not just being a unicorn for the sake of it, but somebody who's providing a solution to a problem. And God knows there are so many problems in service delivery in the country. I think the opportunities are immense. I think the amount of structural reforms that have been done, and it should have been done earlier, but it's now, I mean, everything happens in a crisis in India. The opportunities now for anybody who's willing to take a risk and will have access to credit is so immense. You bet India is an investment destination. As Dilip was talking about, I mean, if we can now begin to integrate into global supply chains, right from the smallest entrepreneurs right up to the biggest corporations in various kinds of partnerships. And partnerships will have to be the key. I think the sky is the limit for anything that any entrepreneur can achieve.
Dr. Velumani, I'd like to give you the last word. And it's a two-part question. The first question, I want to squeeze in an audience question because there's just so many that have come in. The audience question is from Ishan. I don't unfortunately have a last name. He says he's MD at Ishan Enterprises. His question is, was it appropriate for the government to have changed the vaccination policy at the peak of the pandemic, thereby impacting supply? And the second question, and this is my question to you, your advice for an entrepreneur about what perhaps you'd like them to keep in mind for the rest of FY22.
Regarding the first question, the government has no options. Government itself is driven by the COVID. Government has to decide what COVID dictates. Government also has to listen to voices of opposition public. So it's not fair on our part that government has unilaterally taken a decision. This is very, very tough decision, whom to vaccinate, when to vaccinate. It's tough. So let's not say that it was wrong. It was a move which is unwise. Coming to advice for an entrepreneur is a risk taker.
Okay.
Entrepreneur is not a salaried man. And there is a song in Tamil which says, if you see God, then you don't see the stone. And if you see the stone, then you don't see the God. For an entrepreneur, if you see an opportunity, then you don't see the threat. But if you see the threat, you don't see the opportunity. As an entrepreneur, you have to always look at it positively. Having said that, be tech savvy, use IT, use the power of technology to leverage as much as your productivity possible.
All right, gentlemen. Thank you so much for your time. Completely out of time on part 2 of today's masterclass. If you want to know everything else that we're going to be focusing on in May in our masterclasses, do go to our website. All of that information is there. Tonight it's a wrap. Thank you for watching. Stay safe.